What explains the ADHD explosion? More kids are being diagnosed than ever before. Why? During the roughly 20-year period stretching from 1997 to 98 to 2015 to 16, the number of American kids diagnosed with attention deficit hyperactivity disorder increased by nearly 70%. County-level estimates have found that in many parts of the country, close to 1 in 5 children are now diagnosed with the condition. In some southern states, 30% of all boys are getting diagnosed with ADHD, which is crazy, says Stephen Hinshaw, Ph.D., an ADHD specialist and distinguished professor of psychology at the University of California, Berkeley. In those places, we know that many kids are getting medications that don't need them. In recent years, there's also been a steep rise in the number of American adults receiving a first-time ADHD diagnosis. The fastest-growing market for ADHD medications is in adults, especially women, Hinshaw says. Some have argued that ADHD is a manufactured condition, a non-disorder disorder, created in part to help the pharmaceutical industry sell more drugs. Among all mental disorders, attention deficit hyperactivity disorder may be the most controversial. According to the latest DSM diagnostic criteria, ADHD is characterized by a persistent pattern of either inattention. Symptoms include being unfocused, forgetful, poorly organized, and easily distracted, hyperactivity, fidgets, can't sit still, talks excessively, unruly, impatient, or a combination of both. An ADHD diagnosis requires that these behaviors be inappropriate for the person's developmental level. Some have argued that ADHD is a manufactured condition, a non-disorder disorder, created in part to help the pharmaceutical industry sell more drugs, and also to help tired parents and overworked educators manage rambunctious kids. Hinshaw tidily summarizes that camp's viewpoint: "We're just putting a medical or psychiatric label on bothersome unruly behavior," he says. Young boys in particular are stressed and stretched and asked to sit in school for hours at a time, and ADHD is just a convenient medical label for boyhood. While he agrees that the condition is often overdiagnosed and overmedicated, Hinshaw strongly rejects the idea that ADHD is contrived. ADHD exists in every culture on Earth, he says. Clearly, its symptoms are exacerbated by compulsory education, just as dyslexias are, but that doesn't mean they're not real. Why are historically high rates of Americans, both kids and adults, being diagnosed and treated for ADHD? In his book, The ADHD Explosion, Hinshaw addressed that question. He says there's more than one answer. Part of it is cultural. Prevalence of ADHD around the world and across every culture studied is a remarkably consistent 5% to 7%, and it has not gone up appreciably except in the US, Israel, and other very achievement-driven cultures, he says. Some of his research has shown that, in US states that strongly prioritize standardized test scores, rates of ADHD diagnoses are especially high. If there's a lot of pressure in a school district to have everyone do well, there's also a lot of pressure to diagnose kids with ADHD, he says. Unfair comparisons among school-aged children may be another factor. A 2018 study in the New England Journal of Medicine found that, in school districts that have strict birthdate cutoffs for enrollment, the very youngest students in each grade were 27% more likely to be diagnosed with ADHD than the very oldest. In other words, the younger kids were being compared to peers who were a full year older, and their relative, but age-appropriate, immaturity was seen as evidence of a disorder. In Europe and many other parts of the world, cognitive behavioral therapy and other non-drug interventions are the first-line treatment for ADHD. Yet another driver of overdiagnosis stems from the special resources and help, such as additional time to complete tests or coursework, now offered to students with ADHD. Hinshaw says that, 15 or 20 years ago, young people with ADHD tended to be separated and placed in special ed classes. While the shift away from that form of segregation is right and appropriate, He says it has also incentivized some parents to seek out an ADHD diagnosis for their kids in order to secure them every possible advantage in the increasingly heated competition for sterling GPAs and admittance to a top-tier college. People who really do have ADHD need accommodations that support their learning, he says. But doctor shopping and diagnosis seeking among affluent parents who want a performance edge for their kids is a real phenomenon. Overdiagnosis is not a victimless crime. In the US, ADHD is almost always treated with drugs. Those drugs can cause side effects, including problems sleeping and new-onset anxiety or depression. In people who don't need them, ADHD meds can be dangerous. If used in neurotypical kids, especially teens and adults, they provide a jolt of euphoria that can lead to pretty serious stimulant addiction, Hinshaw says. It's worth noting that in Europe and many other parts of the world, cognitive behavioral therapy and other non-drug interventions are the first-line treatment for ADHD. Meanwhile, people who have what Hinshaw calls serious ADHD may be lost in the wash. Rigorous surveys have found that among the 5% to 7% of people who have ADHD, up to half go undiagnosed and untreated. There's evidence that many of these individuals are Black or Hispanic. A 2016 pediatric study found that kids from these demographic groups are much less likely to be diagnosed and medicated for ADHD than their white counterparts. The situation may be similar for young girls and women, more research has found. All this work suggests that while ADHD is likely being overdiagnosed at a population level, it is also underdiagnosed among important subgroups. Right now, a lot of children are being diagnosed with ADHD after spending 10 minutes with a pediatrician. How do we fix all this? Hinshaw says we need more thorough and rigorous professional assessments. Right now, a lot of children are being diagnosed with ADHD after spending 10 minutes with a pediatrician, he says. A proper evidence-based assessment should take hours and involve multiple interviews with parent and teacher input, along with objective tests. A price we pay for a lack of specialists, he adds, is overdiagnosis and overtreatment. Among both kids and adults with a correct ADHD diagnosis, he says the best results tend to come when people are treated with a combination of both medications and cognitive behavioral therapies, rather than drugs alone. Even if these reforms were put into place tomorrow, ADHD would continue to court controversy. Hinshaw acknowledges that, if placed in a different living environments, some individuals with ADHD might not experience any ill effects. So let's take hunter-gatherer societies, he says. If you didn't have to sit still in a classroom or at a desk, and you were off hunting or gathering every day, it might have been adaptive both for the individual and the tribe for some people to be more impulsive. Researchers at King's College London have argued, based on historical evidence, that Leonardo da Vinci displayed many characteristics of ADHD. Even in American society today, he says there is evidence that some people with ADHD may possess neurocognitive attributes that are helpful, not a hindrance. People with ADHD can be good at fast switching, or fast tasking, which may actually be somewhat of an advantage for people engaged with digital technologies, he says. In the same vein, research has found that some people with ADHD may possess hyperfocus, a heightened ability to block out distractions and stay in the zone, which can be either problematic or helpful, depending on context. This begs the question, is it right to label something a disorder and to treat it with medication if, in the right circumstances, any impairment would cease to exist? It's also worth asking what our society loses if we choose to label and medicate people whose neural wiring does not meet our moment's conceptions of typical. There are countless historical anecdotes about brilliant but eccentric people who revolutionized their fields despite being social misfits or failures in school. Researchers at King's College London have argued, based on historical evidence, that Leonardo da Vinci displayed many characteristics of ADHD, and that his achievements might have been even greater if he'd received treatment. One wonders what would have been the impact of his work on history if he had managed to apply himself more consistently to his art, the King's College team wrote in the 2019 study paper summarizing their findings. Another question, one those researchers didn't ponder, is whether today's ADHD interventions might not have interfered with elements of Da Vinci's genius. The controversies surrounding ADHD aren't going away anytime soon. Right now, the only thing that seems clear is that America's approach to diagnosing and treating the condition is flawed, and a lot of young people are being medicated for a disorder they don't have. Thanks for watching.
Written by Markham Hyde.